Welcome to Smut, did you say? Hosted by Nurse Nikki in association with Queerlana. Before we begin, please note that the views and opinions expressed are those of the host and guests and not necessarily Queerlana as a whole. This podcast is for educational and resource purposes only. It is not intended as medical advice, legal advice, or a substitute for professional care. Because of the nature of healthcare work, we may discuss heavy or sensitive topics, including mental health struggles, suicide, sexual assault, death, or violence. Listener discretion is advised, and this podcast is recommended for adult audiences age 18 and older. If you are in crisis or need immediate support, please reach out to a qualified professional or call your local emergency number. Okay, on to Nurse Nikki.
All right, girls and gays, thadies and gentlethems, it's time to answer Smut Did You Say? Where we'll expose ourselves to uncomfortable truths, plow into some pillow talk, and get those burning questions looked at. I'm Nurse Nikki, she, her.
Hi, so I'm AJ Bustle. I am a licensed clinical mental health counseling associate. And a little bit about myself, I'm a bisexual woman, and it's been hard navigating the way through education and everything throughout living in a rural area.
Yeah, absolutely. So we've talked about the experience that you've had in school to get your master's degree, and we talked about your goals in social work and getting into the social work field to begin with. So tell us about that journey and how that's been for you.
Going into mental health and counseling and such has just been very interesting. I started off actually in a similar track to you of like being in a nursing field. And I had switched gears a little bit just down that path of realizing that psychology was more of my niche and mental health was more of my calling. Granted, you can definitely still do that in a healthcare setting, but I just really saw a need and my experience of being around folks who really needed that mental health care and didn't have folks that saw them for who they were. And a lot of my friends growing up and a lot of my co-students throughout school, they just didn't have the means to find counselors who were able to understand the issues that they were going through, especially folks that were a part of the community.
I definitely feel like that on you, or I feel you on that, because working with kids with mental health stuff or any patients with mental health stuff, like you just see the need for social work. And there's a huge need for social work as well with the community that suffers with like mental health disorders or just needing resources in general. But, nurses have to reach out to social work and know that social workers are needed. And then, of course, there has to be people available. So I've looked up the mental health needs for our area as far as clinicians and stuff like that, and it's insane. There's a huge need for social workers, for BH nurses, BH providers, and all this kind of stuff. Like, there's just an insane lack of resources for people. And then you kind of add being queer on top of that, and it just makes it so much harder to advocate for people. Like you said, you're in a rural area. So uh, if you have queer people, like you do have queer people, but are they going to be open with you about their gender identity or their sexuality? Because I mean, it is part of your identity, so it is relevant in counseling. But do you feel comfortable in that area being open with people? Because you just don't know. We had talked before about you being in school and you having to bring up like, hey, this is missing in our education, and this is something that I'm really passionate about, I want to talk about. How kind of that went, what the outcome was for you.
Yeah, definitely. So, and throughout my education, it was a weird path or like journey to go down. Just being comfortable in my identity, especially because I chose to go to a small Christian university for all of my undergraduate and graduate studies. So it was really difficult feeling comfortable as a queer person on campus just from the get go. I will say that my university was great at showing that they were open to diverse folks. Didn't really make me feel a certain type of way about being queer from like the actual school itself, but like the student body was very interesting because, I mean, being in a rural part of North Carolina, it was really hard. Just seeing other queer people because there's very few and far in between, that are comfortably out and were willing to, like, share that part of themselves out of fear of, like, their safety or, being, pushed to the side due to their identities. I will say once I got into my master's program for clinical mental health counseling, it was interesting because I imagined that there would be more folks in the community, like the queer community, and my program, and there was only a few of us. I'd say there was probably only a handful of other folks I met in the program that were actually like out. I did meet a few other folks in the program who had come up to me after speaking out in class about my identity, who were like, "Hey, so I'm not publicly out, but I really appreciated what you brought to our discussion today, and it really helps me feel like at some point I might be able to come out." And that was really meaningful, but it was disheartening to hear that from some folks. And
Yeah.
in my program, all clinical mental health counselors were given that diversity piece, and we talk about, the LGBT community and all of that. But
Like, as this, like, distant thing that's nobody's ever touched it. The LGBT community, ooh, like unicorns.
yeah. And they definitely want all counselors to have this ability to be able to counsel anyone who comes into their office. But I think that's more on paper than what it is like actually. Because there were some folks I met in the program who were uncomfortable with the idea of counseling queer people. And that became a bit of discussion in class and how queer people aren't, sick or going to make you sick. So that was very interesting. Uh,
It's not contagious.
Yeah. It
Mm,
just had me baffled. I was like, "How can you say this?" Because in a discussion we had one time in class, it was funny because our ethics professor was like, "Hey, what type of groups of people do you guys not want to work with?" Because everybody has a group that they don't wanna work with. And a lot of us raised our
mhm.
hands and we were like, "Oh, we don't wanna work with the sex offender community. We may not wanna work with pedophilia or any of that."
Yeah.
And this one lady raised her hand and she was like, "I don't wanna work with, queer people because I don't wanna hear about their sex lives." And I was like, "Hmm, anybody can come into therapy and talk about their sex life, but also not a lot of people do unless you specialize in sex therapy."
Right. Right. Yeah.
Wild.
You can be like, I mean, I feel like as a clinician, you should be able to say, I don't feel that my expertise lies in sex counseling. So we can talk about this, but I would like to refer you to XYZ if you want to like dive further into your sex life. I feel like you should be able to draw a line and say, for instance, there's a lot of literature about how trans or gender diverse patients have to explain certain things about being trans or whatever to either their therapist or their healthcare provider. Basic things like they had to tell them what a binder was or something like that.
Yeah.
It's things that if you are serving that population, you should know, but you should also be emotionally intelligent enough and professional enough to be like, this isn't my wheelhouse. Can I help you find out whose wheelhouse that is? And if you don't want to take care of queer people just because you don't want to hear about their sex life, I feel like for people that are not queer, um, or people that just have this idea of pride being a huge orgy or whatever, they're like, "I don't care who you sleep with," or whatever. It's like, "Okay, but that's not what this is about."
Yeah.
Like, I just wish that I could get people to understand and really take in what being queer means and what pride in the community and in ourselves means, because I just am so sick of having to tell myself that getting into a fight on Facebook is not gonna change anybody's mind, but I really, really wish it would,
Yeah.
because I just don't understand how people don't understand that, and the shitty part is that the people that don't understand that are often in mental health counseling or in nursing or doctors or whatever, and you're like, "You shouldn't be in this field if you have that mindset.
Yeah.
This is not the field for you because the nursing code of ethics says that we take care of everybody in the same way. You still have to respect patient autonomy, you have to respect their privacy and whatever.
They
There was this patient when I worked in the first job that I had, out of nursing school. There was this patient who was a transgender female, and they never updated her name. They would just say, like, "Goes by so and so" in the chart, but the doctors would go in, and because she was a psych patient, they would go in and totally discredit her, and she's like, "My name is, Jane," whatever it was, and they'd be like, "I'm gonna call you the name that's on your government license." I knew I was bi at that time, but I wasn't very involved in the queer community. Like, I was pretty open about it, but I wasn't, like, out per se. I never really, like, came out. I just kind of just started talking about it more. And, um, and so I didn't like it, but I also wasn't a huge advocate for it like I am now. I was also, a newer nurse and wasn't really sure where that would get me. And so I'm like, "I don't think that's right." Like, this is how she's identifying. Don't be a dick. And, a couple maybe, like, a year into me working there, they had a meeting with the chaplains or whatever where they were like, "There's this patient that a lot of you have taken care of," and this patient had ended up completing suicide, which was the reason why they had been coming into the ER so often. And, and they were like, "We've really failed them," and whatever, and I was like, "Yeah." I was like, "It's like, you couldn't have addressed this when it was actually happening. It's not like you didn't know," because she would always say, like, "This is what's happening, like, you always tell me, that I'm a male. I've been female my whole life." And I said something to her, when I was her nurse. "I'm going to address you as this. I don't really care if you were born male or not." And she was like, "I wasn't born male. I've always been female." And so I wasn't really sure how to take that, as if I don't know. It was somewhere on the gender dysphoria line, but I
Mhm.
think what she meant was stop saying that being male was ever who I was, because it wasn't. And I think that that's probably what she was trying to get across, was that I've never been male, don't say that, like, that's not something that I've ever identified as. And some people know in their toddler ages that they're trans, because that's when you start experiencing figuring out your identity.
Mhm.
And, but yeah, they were like, "Yeah, we really failed this patient, and what can we do to be better?" But and then that was so early on in my career, and then when I worked at other hospitals, it was, like, the same thing within the same organization, and then I switched organizations, and then it was the same thing there. I had a trans male patient who was pregnant, and my clinical supervisor was laughing and using she pronouns and stuff, and I'm like,
Mm.
"It he uses he, him pronouns, and he's male, and this is his name, so respect that." And at this point, I'd been a nurse for probably like 4 years or something. I had my viewpoints, and my, like, "Don't mess with me" about my community type of thing was already, like, really starting to go at
Mhm.
that point. And I didn't report it because I didn't know the proper channels to do so. And I was like, "I don't even know who to tell, like, he's my supervisor," you know? But now I know that you can report things like that through the Joint Commission if you don't feel comfortable reporting directly to your managers or supervisors or whoever. And every hospital should have an ethics council, which is it's going to be like through your spiritual care people. So you can either talk to a chaplain, or you can look up like corporate compliance, and there should be some sort of ethics reporting. But every hospital should have that, and I would hope that there are channels like that for social workers to use as well.
Yeah.
But I mean, it's just like you said, it's in the education for these things, like, it's touched on, but it's such, like, this magical, like, group of people that's so rare that you might not, like, encounter. You might not ever end up working with somebody like this, but I mean, like, there's a lot of us, and, you know, it's like a very small percentage of the population is transgender versus cisgender, yes, but you are gonna really mess with a large community of people when you're saying that you don't want to deal with any queer people at all. That's a pretty significant number of people, and we're not just these rare things, and we're not something that needs to be swept under the rug, and it's not a disease, and But the people that are giving healthcare, whether it's mental or physical, still have all these discriminatory practices. And I will tell you firsthand experience, I've reported discrimination not only against myself, but also lots of patients over the last year and a half that I've really been involved with advocacy and stuff like that. And nothing has been done. I've been given a lot of promises, but nothing has been done. And after the current administration came into power, I was told that nothing was going to happen for a bit because they weren't sure where their diversity and inclusion stuff was going to be, and they weren't sure like what kind of funding they were risking and blah blah blah. And so when they finally did get it all settled, I'm like, hey, like you guys are making some pretty crazy policies right now. I need to say my piece and I need to get involved. And they're just like, okay, well, I'm going to set you up with this. I'm going to set you up with that. And you should hear about it next week. So the next week comes around and I'm like, so I haven't heard anything. And they're like, oh yeah, we're just really busy working on stuff behind the scenes. I'm like, why can't I be behind the scenes? I want to be behind the scenes. And, um, and so I just keep pushing buttons, and I think I might get fired, but I don't know.
Hopefully
you
not.
know? Yeah, I hope not too, but at the same time, and I tell my husband this, it's scary, but not scary enough to stop.
Yeah.
And I'm like, I am worried about some things, but at the same time, I'm more worried about the future of like my friends and my family and my patients that are part of the queer community that either don't have the ability to speak up for themselves or are just so tired of having to speak up for themselves that they're just like, nobody even cares anymore. Why even bother? I still have a voice and I have privilege being, straight appearing. But but yeah, sorry, my little rampage there for a second.
No, you were
That's what I call a
completely good.
knick-knack. But tell us about what we had talked about before with improving the education that your school had surrounding the queer community.
So I wouldn't say that in scope that it was a whole program or anything like that, but just within the one class that we took in my master's program for diversity, it's on multicultural counseling is where we took a look at every single aspect of someone's identity and how that can be different across many different ways. And in that class, it was interesting because we each had to do several different group projects, and then we had to do another project where we talked about every single part of our experience and who we are. And that one was interesting. I was the only out queer person in the class. We did have someone else come out during their presentation, which was interesting because it was after I
Oh,
died. And I was like thrown
yeah,
off. I was like, "Oh, I thought I was the only one here. Hi."
right.
And
You're
then
like, hey, girl.
yes, I was like, "Oh, thank you for actually like speaking out." Because like it felt like when I was presenting about that, all the eyes were on me. I was supposed to be the says all, tell all about being queer, and I was like, my
Yeah,
experience
you're
is
the
a
only
lot
one with the answers.
than someone who maybe looks visibly queer, because I also relate to having that I guess like straight passingness, um
Yeah.
or it may be completely different than being a queer man. So I was like, my experience is not the end all be all, it's not gonna explain everybody's. And then we also did a project where we had to like explain a certain group or a certain part of your identity. And I really wanted to do the LGBT community for that because I felt like it was important to have at least one queer person on that project. And it mostly went well, but it was insufferable at some points because my two group mates, they were fine until I was being corrected because of what was in a textbook versus what I
Hmm.
knew was true life. And I was like, these
Yeah.
textbooks are great and they give us great statistics, but they're not all factual. It's not everything that it says in the book. I will say something that I did learn in grad school from one of those books was really interesting. I mean, it's a stat that's thrown out a lot, but like given that there's not a lot of exposure I've had to queer literature before hitting college, that, bisexual people tend to be the largest part of the community and we
Yeah.
get hated both in and out of the community. I can't remember the number off the top of my head, but it was massive. It was massive.
I've heard that recently too. I'm like, yeah, I guess that makes sense. But like, but we get hated on um by both gay and straight people because it's like, you just pick a side.
Yeah.
And then, like, there's this hate between, like, pansexuals and bisexuals. It's like, well, you're either pan or you're gay or whatever, and, like, my definition of bisexual includes other genders. Like, it's my gender plus other genders,
Yeah.
So I think bi plus is, like, a new thing that they're throwing around, but I don't identify as pansexual mostly because I don't like yellow. But, but I also don't identify as pansexual just because I I don't. Like, it's just, my initial introduction into being queer was I like women and I like men.
Mm.
And and then when I met more, like, non-binary and trans people, I was like, "Okay." I was like, I guess I'm into all of them. Like, I was like, I don't really wanna pick, but, like, I'm into feminine and I'm into masculine, and I'm also into the in between, so I guess I'm pan, and then I was like, "But should I have to change just because you know, that's like, oh, okay, I don't wanna be like I was bi," and then I realized that there's other people and they're all attractive. So then there's this bi means love and attraction regardless of gender, and I was like, "I like that because it's like, there's my gender, and I like that one, but I also like other ones. So you don't really have to, like, pick, but, like, bi just means that it's just not one,
Yeah.
but it doesn't have to mean 2, it means mine and others. So, but, like, pan, I felt like it was more that gender didn't play a role
Mm.
in your love or attraction, was that it's just the person, but to me, the gender expression is important because there are sometimes, like a gender fluid person, there's sometimes where I feel more attracted to one versus the other, or I'm, like, really into somebody that's in between or
Mm-mm.
whatever. But, you shouldn't ever have to feel like you need to explain yourself.
Mm-mm.
Because 'Cause I've also, talked with trans people who say, like, "Am I really trans if I don't want bottom surgery?" It's like, "Yeah,
Yeah.
you are." Because you look in the mirror and you like who you see now that you've been on hormones for a while, or that you've had that you've done things to either feminize or masculize yourself, or you're non-binary and you just really feel affirmed when people use your pronouns correctly, and, like, you don't have to explain yourself to anybody. You don't have to look androgynous. You can be totally femme appearing and still use she, they, them pronouns. And that's kind of like what you're talking about, which I'm sure was in your textbook, is that it's like this cut and dry, like, bisexual people are attracted to both women and men. Okay, sure, but, like, that's not exactly true.
Mm-mm.
And then you say, like, lesbians only have sex with females. Well, that's not
Not true.
entirely true all the time either. And, and it's and then, they would say, like, non-binary people only use they them pronouns. Well, that's not true either.
Yep.
So there's, like, a lot of different things that you won't know unless you're in the community.
Yeah.
And, like, a lot of things that I learn all the time, and so many of us are learning all the time, especially about the trans and gender diverse communities, because that's not our experience.
Mm-mm.
Like, I will learn about it all day, every day, but unless I actually learned that experience from living it, I'm not going to be able to speak to it.
Yeah.
But
Me.
the main thing is that whether if you misgender somebody, we all do it,
Yeah.
but the important thing is, like, you support your kid's journey or your friend's journey or whoever, and you let them decide when they're gonna come out to whoever they're gonna come out to. And, and if they do decide to, like, come out to their grandparents or something, and their grandparents continue to, like, misgender and dead name them, that you stand up for them and that kind of thing. But if they don't wanna come out to them yet, you're not going to, like, bring that up to them. Like, "Hey, just so you know, like, these are their pronouns now." Unless they ask you to do that for them, you need to respect that. But
Yeah.
but, the the textbooks aren't gonna say what needs to be said. And that's kind of the experience that I've had in nursing, is that the organization overall is supportive, right?
Mm-hmm.
Because it says we don't discriminate based on sex, race, it's whatever. Like, we don't discriminate, right? And where everybody's included, and we'll give the same healthcare to all, and blah blah blah. And then you go to these annual trainings or whatever, and they're like, yeah, queer people exist. Let's move on. And it's like, you
Yeah.
didn't cover like anything. You just said like don't discriminate, but you didn't give specific things about how people are discriminated against, what things you might come up with, or like in emergency situations it's still important to make sure that you are referring to people correctly and that you're using the correct names. There's like different trauma training for emergency nurses, and they talked about how the transgender population is like a special population because they require like different care, but it was mostly about the fact that uh if a patient presents male but they still have female like gonads and everything like that, that they can be pregnant. And that was like basically the main thing. And that there was a something about the Adam's apple, like if they've had their trachea or what, I can't remember what it's called, but there, you can have it shaved to where your Adam's apple's not as prominent, and that like can cause a if you have trauma to this area, like from an airbag or a seatbelt or something, then that increases your risk of having like an airway injury, or like having airway complications if they're like trying to like get an artificial airway in there,
Oh,
because there's scarring there where they wouldn't be before. But they also left out things like if somebody's wearing a binder, probably don't cut that off unless you absolutely have to, because A, you don't know if they have access to another one. B, it's part of their identity, same as like a religious talisman or something like that, that you wouldn't want to cut off somebody unless you absolutely had to. And now I understand that if you need to get to this area and you need to get to it now, you're gonna cut it off.
yeah.
But like if you're just cutting it off to get them trauma naked, like you didn't need to do that.
Yeah.
And also sometimes I feel like a binder would be helpful for a lot of situations because it's keeping everything, because we put chest binders on people, like abdominal binders and things like that for certain injuries. So I think that in some ways that might be helpful. But kind of the reason why I want to do this podcast is that sex and sexuality and things like that are so taboo in this society, whether you're straight or queer. But I was telling somebody else about it, is that I feel like straight people have more, um, it's not as taboo for them to talk about their sex lives,
Hmm.
because for the straight community, like the queer sex life is like so,
It's
it's
like
like,
vulgar and dirty, and that's not really
yeah,
the
yeah.
case.
But you can watch a movie that's a kids movie and they're insinuating that people are going to bed together. But as long as it's a male female relationship, that's fine. And, they can all be like making out and all over each other and everything like that. But as long as it's a male female relationship, it's not shoving sexuality down people's throats.
Yeah.
It's not sexualizing the children or like being a predator or anything like that. It's just life. It's love. Oh, they're so obsessed with each other. They can't keep their hands off each other.
Yeah.
But if they're gay, they're predators, and they're gonna like steal the children, change their genders at school, and then send them home as a different gender and stuff like that. It's literally insane, the things that people say and claim are happening.
Yeah.
But yeah, some of the people were talking about how they didn't want to see parades about people having sex with each other, and they didn't want queer sex being shoved down their throat. I'm like, where is this happening? Like, where are you going that all that's happening is a bunch of queer people having sex? Because I would like to know, for just for research purposes,
Yeah.
where all these huge queer orgies are happening. I
Yeah,
just was
no.
curious.
I'm just curious.
But but I also think that if queer people hear don't don't have stories from like other queer people about like, hey, this is how I experience my queerness or my sexuality or things like that, that if they don't have that, then they're not going to realize that there's a lot of things that they experience that other people experience as well,
Yeah.
because it's just, there's this whole spectrum of things that happen, and it's like any sort of kink. Like there's somebody that's into something, and you may not personally be into it, but there are other people that are also like, "Oh, hey, I'm into that," like, I'm not I'm not into the whole, like, feet thing, but, I mean, that's a thing for, like, a large group of people, I'm not gonna yuck anybody's yum, but I don't really wanna get in on that myself.
Yeah.
Um but yeah, it's I think that the the main reason about this podcast is that I just want people to hear not only that there are people advocating for queer rights in the healthcare system, but there are also people who are like, "Hey, let's talk about sex. Let's be open about it.
Mhm.
Let's say if you have questions, you can ask me." And if you have concerns about stuff, like, you can find a provider that will help you go through that, and if you can't, then there's some elder in the community, like, that can talk to you about it and help you realize that you're not crazy, and you're not alone, and you know you're not gross, you're not sick, things like that. Like, I just want people to understand, especially in the queer community, that all these things are a spectrum. And the other thing that I want people to understand is that you should absolutely advocate for your mental health providers to be the right ones for you.
Mhm.
And I'll
Yes.
link the resources that I have for finding mental health providers that are either LGBT friendly or are actually LGBT themselves.
Mhm.
Um, and also the resources for looking up different providers of different specialties wherever you are in the country.
But no, yeah, I mean, not to get you off beat or anything like that, but
Oh, you're fine.
definitely, just trying to have that within the mental health space it can be hard. It can be hard, but it definitely needs
Yeah.
to be there. Because it's every client's right to have their choice of provider, just like within a medical sense. And I feel like that's not said enough. And there's this one community, like amongst like all people who get medical care, and that's like the Medicaid group. And
Mhm.
they really
Yeah.
struggle to feel like they have a choice in their provider because of the
Because they don't often, because, like, certain providers will turn down Medicare patients, or they only take a certain number,
Mhm.
or, there's only a certain number of people in your network, and if you are from a rural area, there's probably, like, 1,
Yeah.
and then you're shit out of luck.
Yeah. I remember
But
driving,
yeah.
like, a while if we had to change one of my providers growing up because I grew up on Medicaid, and it was hard, even though majority of the folks in our area were also on Medicaid, so,
Yeah.
but I think that for a while before this administration was coming into effect, that I thought that was changing for a while. It felt like there was more of an understanding that, like, folks had a right to their provider regardless of it was mental or physical health.
Mhm.
But now it's a very scary time just seeing the all the cuts and everything, but we don't have to go down that rabbit hole right now. But it's just a very frightening time for not just queer people, but people in general. Um, and just seeing that like not feeling like they have a right to a provider. Like I would not want any person, especially in the queer community, to be seeing a counselor who isn't knowledgeable about their specific identity or isn't willing to do that extra little bit of work outside of their 8 to 5 or 9 to 5 just to learn more about
Mhm.
how to support their client just because
Yeah.
they don't know if they will get services somewhere else or they don't want to be
Yeah.
paying out of pocket because paying out of pocket gets extremely expensive very quickly
Mhm.
which
Oh, yeah, 100%.
that's a peeve I just have in the mental health world as it is, just because I understand that we need to make our money, but at the end of the day, we also need to be accessible. Now finally being licensed, I can see the toss up between that because yeah, I want to get paid, but I also want to be accessible for folks who really need the resources, you know?
Right, yeah. So, I think that that also comes down to the failure of just the healthcare system in general, but the American healthcare system is insane. Like, literally 70% of what is made in the US healthcare system goes back to, like, big pharma and the, stakeholders of
Mhm.
the big companies. So I looked up my administration's bonuses from last year, and between the like four highest earners, their bonuses were like $16 million.
Oh, wow.
And I was like, that's literally insane. And and I was just like, and then you're talking about how you don't want to I can't be too specific about it, but there are certain things that they're not willing to do because of the threat of loss of Medicare and Medicaid funding
No.
because of the administration. And but then they brag then they brag about how much money they've been making and all of the donations and grants and stuff that they've been getting so they can do XYZ for certain groups of people. Like, it's awesome that you're like providing more robust care for like people with cancer and stuff like that. But then you're telling certain people that are raising a stink about the lack of education and proper care for like gender diverse and trans people that that's not something where they want to put their money, or that's not something that can give you a return on investment, and all this bureaucratic bullshit that I've keep hearing about stuff. I'm telling you that there's this entire group of minority that you're discriminating against, even though you have an anti-discrimination policy and you don't want to do anything about it.
Yeah.
Like, it's crazy talking about advocating for yourself in both the mental and physical health space. um, People are made to feel bad about like trying to change providers, or they'll feel like they're stuck, like they don't have an option
Mhm.
because they get good care for X part of whatever, but then their provider doesn't understand their needs based on their gender identity or their sexuality or whatever, or say like, you want STD testing or something like that, but you haven't disclosed something about your sexuality and you don't feel like you can.
Mhm.
And, there's just certain things where there's a lot of hiccups with people advocating for themselves. And I think the main thing is that people don't know what resources they have and don't know where to find other providers in some cases. And other times it's a big pain in the ass, really, to change your providers. It just takes forever to get into a new healthcare provider. It takes forever to get into a new psychiatrist, that's for sure.
Yeah.
And
A lot of wait
and
lists out there for
yeah, for
counselors
sure.
too.
Well, especially like you said, the Medicare group is like, to get into like a nursing home or something, they have a certain number of Medicare beds, and a lot of practices have a certain percentage of Medicare patients and they don't go over that percentage, or there's a lot of roadblocks, and it's only going to get worse. And that's another, like you said, another conversation for another day. But
Sorry to get off that rabbit
yeah.
hole. It's been on my mind a lot at work because we've talked a lot
Yes,
about
oh,
Medicaid
same,
cuts.
yeah, being in case management now, it's something that I keep hearing where I'm like, "How come we have to do this? Like, can't we recommend this?" And they're like, "Oh, no, that's Medicare fraud." And I'm like, "But I don't agree with their assessment, though." And they're like, "Nope, you can't do anything about it." I'm like, "But that's I thought this was the whole point of being case management, was that I can do something about it." And they're like, "Nope, the recommendation is the recommendation, we can't do anything about it."
Hmm.
Okie dokie.
Wow.
I'm so glad I changed jobs to be more of an advocate.
Yeah. And
But, plans for your future as far as your social work life, because you told me that you aren't specifically in the realm of taking care of queer patients, but say we're talking like 5 years down the line, the world's become a better place again. Like, where do you see your professional journey?
so I mean, like you said, currently I'm not specifically working with just queer folks, but I do have some that are under the care of the team that I'm working with, which has been great being able to have those individual connections with them and giving them the support. Also being the only out person on the team, I feel like there's been a lot of gravity towards having a good rapport built there, just
Yeah.
given a safe space. But in the future, I know I was in school for a long time, but I do see myself going back into a PhD program so that I can do supervision and education in a counseling program somewhere, just so that there's more of that piece within the curriculum at whatever university I go to. I'd also like to work at other colleges along the way, just to have some experience before going into that. But as far as for like practice, I think that I would love to start in the next year or two, just start doing like independent work that specializes in queer counseling. And then eventually, I would love to open a private practice or a small practice with a couple of other queer counselors that is specific to just all different needs and open it in a rural area in North Carolina. Currently, I work out in Morganton, and it's interesting because there's not a lot of services east of Asheville. And so just
Right.
seeing that is absurd. So anywhere between Asheville and like the other larger cities that are like, Winston or like Raleigh
I
or
feel like even Shelby is still considered really rural, even though they have like a hospital. It's not a big
yeah.
hospital. There's one there.
Yeah. And so just being in an
But yeah.
area, I mean, I grew up in Iredell County, so like we didn't have, I mean, not to be vulgar, but we didn't have shit. So like it was just frustrating.
Still don't.
We still don't, Um, I mean, barely any queer counselors out there to this day. I don't think I'd want to stay in Iredell just because I've had enough of it. But there's a part of me that thinks that it would be really healing to be able to bring that peace back to that area. Just seeing how I've met so many different queer people. I mean, just throughout school, and I worked for coffee company for a long time that hires a lot of queer people because they have
Yeah.
great poster values, but not
Yeah.
actually showing that they care for queer people. Um,
Oh, yeah. Yeah,
yeah.
100%.
And it was just really frustrating, seeing how many folks that didn't have the access to counseling and how many of my friends who had to drive hours or like drive an hour to just go see a counselor who would be able to work with them and write, like top surgery letters or, help them with hormones and stuff like that. And I think that's outrageous that they had to go the extra mile when it should be the other way around, that,
Oh, yeah,
there's
100%.
more around. Um,
Yeah.
and it's just, I don't know. It's also very frustrating and a scary thing because, like, I specifically wanted to work with LGBT youth, and it's frightening because now you're not 18, you can't really do too much in
19.
our state. Um,
19.
it's 19.
Mhm.
I thought it was 18. Oh my god.
19.
Oh wow. Okay. Love that. Love that. So
Yeah. You can sign your life away to, go to, like, overseas and shoot people and whatever when you're 18, but you can't have top surgery or
that's
gender affirming care of any kind.
absolutely ridiculous. Absolutely.
Yeah. Oh, except for mental health services. The organizations that are ending, gender affirming care are like, "But we still offer mental health services, and, there's a 24/7 helpline, so if there is an issue with their mental health, they can call us and let us know." I was literally like, who in their right mind would stay in an organization that ended part of their gender affirming care but only kept the, like, mental health aspect? Clearly, mental health is not your concern. It's keeping
Yeah.
your Medicare dollars, but,
That's just to cover their own tails at the end of the day.
Oh, 100%. Yeah, because you can't leave them high and dry. You have to make sure they don't kill themselves.
Yeah.
So
Oof. And with doing crisis work, and having that experience, it's interesting to me. I'm glad that we have, all of these different crisis lines that you can call, but it's so much different
mhm.
when you have a connection with somebody and you know them or like have some background about them. But if someone's in genuine
Yeah, like, if you've
crisis,
already spoken to them and they are also your crisis counselor, not
mhm,
just, like, calling, Daymark or something like that, which is a great resource that we have in Statesville, but if you haven't been seeing a counselor there and they don't know anything about you, I mean, it's like being out of state and going to a hospital that has none of your records. you're starting from complete scratch and you have to explain everything about yourself
Yeah.
from your physical health conditions. Imagine it being from your emotional state
Yeah.
and things that are going on that impact you, like all of your triggers, all of your, your past traumas and stuff like that. Like you shouldn't have to explain that when you're in a freaking crisis.
Yeah.
Like, it would be super awesome to have somebody who's already made, like you said, made a connection with you to be like, "I know we've talked about this before. Is this, what we're dealing with in this moment? Like, how can we work through it? What's helped you in the past? Like, I know that you've told me this has helped in the past," things like that. Like, just like I said, just like having their records, having their history
Yeah.
is so important.
It really is important just to have that background
Yeah.
piece. Like with the work that I do, we go based off of a crisis plan. So even if you haven't met that client before, you know a little bit. Like you can pull it up while they're
Yeah.
telling you about their crisis so that you're not scrambling and having to have them tell you XYZ, oh, I have this trauma, or this is my
Yeah.
trigger, or these are my supports. Like you don't have to sit there and be so inquisitive because I know when you're
Yeah.
feeling like you might hurt yourself or harm someone else or you can't breathe from a panic attack, it's like you can't talk about that right now.
Well, and at a certain point, I think that if you're being questioned and you're feeling like you're being interrogated, you're gonna just hang up the phone and tell them that, like, everything's fine and just pretend like everything's fine and just, like, hang up and do whatever you were gonna do anyways.
Mhm.
And, but like you said, even if you just have, like, a little snippet of information, and a crisis plan is an amazing thing to have for people. Um, just saying like, "Hey, like, if I'm experiencing a crisis, this is the best way to support me," or like, "This is what is probably triggered it," or something like that, or "This is a common thing that happens," and you can have that information, you can better care for your patient, and like you said, make them feel like they're supported and they don't have to freaking explain themselves when they can't even breathe.
Yeah.
And yeah, I think that's amazing. Um, I do remember a topic that we got squirreled off of was I was asking you about the changes made to your program right before you left your master's program.
Oh, yes. Okay,
If
okay.
you wanna if you wanna talk about that, because I remember you
Oh.
mentioning that and I thought that was super cool.
Oh, yes, yes. So throughout my program, it was really interesting because, like, they'd ask us every semester, they'd say, "Hey, what kind of classes do you want to see?" And they give us some options. I had talked to one of the top people of our program. I forget what the official title of like her position was, but I was like, "Hey, I think we need to have more of like a gender and like sexuality class." And she's like, "Oh, yeah, we've kind of done something like that way, way long ago. And, we could maybe try to start that up again." And I was like, "Oh, that'd be
Yeah.
great. That'd be great." And then they started
Yeah.
offering it right when it conflicted with a lot of the things I could do. But I was really glad to hear that they offered the class. It's just it never lined up with me being able to
Yeah.
take it. But from what my classmates had told me about, being able to take that class, it was really cool because I got to just destigmatize sex. I got to destigmatize anything, you know, of any type of sex. They talked a lot about
Yeah.
different gender identities, and I think
Yeah.
that is crucial, especially for folks going into counseling.
Destigmatization is we talked about destigmatization of mental health, like, for so long, there's still so much of a stigma, but it's not nearly as much as it was before, and I think part of that is thanks to, like, the Gen Z people who have been so open about their mental health struggles and their traumas and almost being, like, blasé about, like, having suicidal ideation or whatever, just talking about being traumatized or um, being whatever, like, I feel like they're just, like, a lot more open about it, and it's made people who still stigmatize mental health say that that generation is just weak or whatever. It's like, no, it takes so much strength and self-assuredness to be open about your mental health
Mhm.
and to be open about your own struggles that you're having. It doesn't mean that you're weak. It's in fact the complete opposite. It's incredibly brave
Mhm.
for people to be that vulnerable with especially with strangers. But even with like mental health and physical health professionals, it takes a lot of courage to be open about something that you haven't been before. And simply asking people what they want to be called or like their pronouns can open that door and say, like, hey, it's safe in here. And just saying, is that what you'd like me to call you? Opens the door to be like, oh, they're not just asking if I have a nickname. They're telling me they want my identity. They want to know how to address me. And I'm really glad that you heard from your classmates that it was a good course, because we had talked about how a lot of the education surrounding the queer community is like clearly written by straight people.
Mhm.
And I think that, like you said, destigmatizing sex for straight people and for gay people, I think is a huge first step to being like, okay, first of all, it's not just about sex.
Yeah.
And second of all, sex is fine. It's human. Like, the less stigmatization you have around sex, the more that people are going to understand that certain things are not okay. Like, certain things are super risky behaviors or are not appropriate. And just like the more that we're destigmatizing sex and sexuality and whatever, the more sexual health services are going to be utilized as well. Like, people that only have sex with people of the same gender still need certain medical screenings that you might not think that you need.
Yeah.
Like, if you're a gold star lesbian and you've never had a penis near or in your vagina, like, you still need a pap smear. Like, you
Yeah.
still need to get screened for cervical cancer. You still could have HPV, like there also, people need to know that you're not going to get screened for HPV until you're 30. So if you get one when you're 29 and then you don't get one again until you're like 40, well, you're missing a whole slew of testing that should have been done forever ago if you're
Yeah.
if you've been at all sexually adventurous. And that's a whole nother that's going to be a me going off on a rant topic.
That's okay.
but um but yeah, I mean, like, destigmatizing sex in general for everybody is super important to, like, helping people understand, like, when things are a problem and when things may become a problem, and, like, when to start being worried about things, who you can talk to about things. Like, Planned Parenthood has courses for young adults about, like, sexual health. Time Out Youth in Charlotte has courses for, like, sexual health. Yeah. Youth Outright of, like, Catawba County,
Mhm.
Outright Youth of Iredell County, PFLAG, like, all of them have, like, these amazing, like, let's talk about sex, and you don't have to be queer to utilize them. I
Mhm.
mean, you could just be an ally and be like, "Hey, can we, like, talk about, like, sex, so 'cause I don't have anybody to talk to about it." There's all these amazing things. A lot of them are geared more towards teens because they expect that by the time that you get to your adult years that you've already learned these things, but that's not true.
Yeah.
Because 'Cause I've met people, like, 5 years younger than me that have not heard of HPV or, like, don't know how to deal with having HSV. Like, there's so many people that lack so much knowledge because, like, even myself as a nurse, the conversation about, like, STIs was, like, very minimal.
Yeah.
And then going into the ER, we just do the testing and we say, "Okay, we're gonna empirically treat you for this because we can, um, nip it in the bud right now." And then they're like, "But if you want more than just this testing and you don't have any, symptoms, then you need to go to the health department." Well, I mean, a lot of people don't wanna go to the health department.
Yeah.
And I I'm pretty sure there's a long line at the health department, but there are a ton of resources like, Planned Parenthood and other testing sites that test specifically for, like, STIs. And then there's a lot of resources for, like, HIV and AIDS testing and, like, getting free PrEP. But like I said, you have to start with this destigmatization
Yeah.
and, like, sharing that information with people, because there was no education, like, given from the doctors for, like, these people that were concerned about, like, XYZ. They're like, "Well, what if this comes back positive?" And then I'm like, "Well, if it does, then, you need to have that discussion with your partner." Well, I don't know how to talk to them about it. And then, but there's, like, you can have a meeting with your partner, or without your partner, with somebody at Planned Parenthood to discuss how to talk about STIs with your partner. Like, they have, like, specific, like, appointments that you could make for that. And again, people aren't going to know these things unless they're openly, like, talking about sex and talking about their concerns and being and being open and honest with their providers and being like, I don't know anything about this. Like, can you help me? And or just knowing like what to type into a search in Google to know what to look for.
Definitely need to
Yes.
utilize it. But not to circle back, but another resource to add to the list of things that you were mentioning. I don't know if you know of the
Yeah.
organization Alpha, out here in Catawba County.
Alpha?
Uh-huh.
No.
So it's an awesome organization. They do a lot of sex education. They give out free prep. They talk a lot about the benefits of being on prep. They do, I think they offer testing. I might be wrong on that one, but they do offer lots of like contraceptives,
I
education.
feel like even if they didn't, they would know like where to send people though.
Mhm. And they just do a lot of things within the community. Back when I was an undergrad, we did I did an internship where we went out into the community and we educated folks on the COVID-19 vaccine. And we worked really heavily with Alpha because it was also important for them to get some spotlight to talk about sex health and what their organization does. And I just have an utter deep respect for them because they were giving
Yeah.
out so many free resources to the homeless and impoverished areas of Hickory. Um,
Mhm.
yes, and it was nice because they were giving them like also things that they could use, like temp controlled condom carriers and things like that. Just things that really are needed. Like
That's awesome.
it wasn't like fancy or nothing, but it was basically like a Yeti for condoms. Like, and it wasn't expensive
Yeah.
or anything,
I
but
haven't used condoms in so long that I just didn't even think about the fact that they I mean, they absolutely do need to not sit in a hot car,
yeah.
you know, or be in your pocket, in your wallet, like, they're gonna lose integrity if they're just, like, up against your body temperature all the time.
Yeah, and it's just a
But yeah, it makes sense. Ugh,
and, the great organization, and they are everywhere. Like, anytime I go to an event or a festival out here in Hickory, they're definitely trying to get that information out there. I don't know how often folks are actually, like, going up to their tables, but it's great that they have a presence there because we need to have more of this out in the community, you know what I'm saying?
yeah. Well, I was at Charlotte Pride, and they were like Charlotte Mecklenburg Health Department and stuff was, like, handing out, like, bags of condoms. And, and they were, like, asking, like, cute little they were doing, like, a little, like, quiz about, like, different, like, STIs, and you could, like, spin the wheel and get something for free and stuff like that, but, like, you know, Hickory
Yes, I
is
agree.
very, like, southern and, like, it's not a super small city, but it is still rural,
Mhm.
and there is, you know, the Catawba Valley Pride is there,
Oh, yeah.
and, like, Newton Pride is around that area.
Mhm.
There was another, like, pride
Trans Pride?
organization. What?
I know we do a trans pride as well, which is different
Yeah, yeah, yeah.
earlier in the year.
But there's 2 organizations, and they both had, like, pride events, and I can't remember, but they were both, like, Catawba County. But I know, like, Catawba Valley Pride is in the middle of September,
Mhm.
and I'll be there, so I can, see if I can connect with Alpha there, that'd be cool.
Yeah, yeah.
But yeah, just, like, having, like, sexual health stuff. I met somebody at, Comic-Con in Charlotte who did, like, comics about, like, destigmatizing sex and stuff like that, but theirs were, like, specifically for the queer community as well, but they were just talking about, like, get it out there and, like, talk about it and do it in, like, whatever format you can get it out in. Like, mine is, you know, doing the podcast and talking to health professionals, and theirs were like writing a comic and like drawing pictures about it and getting it in front of people that are that kind of audience. And and you know, like I said in the beginning, is helping people understand that they're not alone, they're not weird, they're not they're not sick, you know, they're not the only ones who are doing certain things, and there's something out there for literally everybody, and yeah, I think that the more that we help people understand that, the more people will be comfortable about, like, coming forward to health professionals, the more that they can feel like they can advocate for themselves with health professionals, whether it's talking to your current healthcare professional about, like, them becoming more knowledgeable about your specific, um identity and stuff like that, or just being like, "You know what? This isn't working for me. I'm gonna find somebody else." But yeah, I want to empower people to be like, you know, do talk about it, take charge, and if somebody's not not fully supporting you and listening to you and helping you grow as a person and and everything like that, like, kick them to the curb. Like, like, just you don't have to settle for anybody. You don't have to settle for a romantic partner, you don't have to settle for a health provider, you don't have to settle for anything. Like, you go after what you deserve, and that's, like, total support from people that are supposed to be supportive of you.
Yeah.
And but, yeah. So, uh, we've talked about the education system and how, different even, either mental or physical health, like, they can both really improve as far as, learning about the LGBT community and advocating for the LGBT community, and, like and you going into education and stuff like that, like, that would be just amazing for you to have, the next generation of queer mental health providers being like, "My professor's openly queer. This is awesome." And, I mean, even if you were doing clinicals or you were just doing one class or something, I mean, they could still reach out to you and be like, "Hey, like, I know I haven't had you in however long, but, this is what I'm going through, like, could you talk me through it?" And like, just having that connection and knowing that you have a support in that higher level, I just feel like that's so important to people, and I'm just really excited for you, and I'm excited for the young queer people that come into your class and realize that they're finally getting an instructor who sees them for who they really are, and they can be open with, and they can be themselves with, and like you said, like, there were a lot of people that were closed and closeted and, were like, "I'm not out, but thank you." And, like, you could just be talking in front of everybody and be an advocate, and I just love that for you, and I'm just so excited for you to get there, and I'm just gonna be your cheerleader the whole time.
Thank you so much, Nikki. You're awesome. I'm really excited for you and all the things you're going to get to do moving forward, through your master's program and even afterwards, because I
Yeah.
feel like it's still hard to advocate, but I think with higher education comes with more ability to advocate. So as you're climbing
Yeah.
the ladder, you'll be able to do it just more and more.
And the longer you stay in school, the longer you can defer your student loans. So, and then, we talked about your, plans, as far as getting to the education point and getting to the point where you are working with, specifically with the queer community in rural areas. And I think that's amazing. Um, I, talk about you being part of the queer community yourself. Didn't really touch on, like, personal experiences with, like, queer and trans friends and stuff like that, but I mean, they're there.
Yeah,
And
I
but
adore my all of my friends that have gone through all the things that they shouldn't have throughout their
yeah,
journey. Just being in such a small rural area, because the town I'm from maybe has not even 200 people in it, so very close-minded area.
yeah,
So it's just been, it's hard if you don't have people who are just there for who you are as a person. So I'm glad that
right,
I was able to.
and like you said, is especially in a small community, it makes such a big difference, and just affirming who people are, like, it goes back to just ask people what they wanna be called. Just affirming who people are makes such a big difference, and you could literally be the difference between somebody being here tomorrow or not, you know what I
That's a
mean?
big
Like,
one.
just being like, "I accept who you are, and you can be you with me," can be enough to literally save somebody's life.
Mhm.
And, I just wish that more people had that because I know some people don't.
Yeah.
And yeah, and whether it comes from your a teacher, a counselor, a nurse, or whatever, like, you can just being affirming to somebody can make the absolute world of difference. But yeah, and then circling back to resources that we talked about resources on where to find any sort of resource from providers that are either openly queer or openly supportive of the queer community. We talked about alpha that I didn't know about, which I'm definitely putting in my list. And we talked about resources on like sexual health, education, testing, that kind of thing. And just the ability to advocate for yourself and to get involved with different community organizations who can foster that independence and self-advocacy with you, that you can go to and be like, hey, I have a issue with this. I'm having an issue with this. Like, I don't know how to deal with it. Like, there's so much support in the community from so many people, and just going to one pride event can get you connections with people within your own community who can help bolster that. And if you need help finding um events in your community, you can start following one and they will lead you to all the others, or you can ask me and I can help try to connect you, because I've started following them just as like a creator and somebody who was like doing arts and crafts stuff at festivals, but just being more of like a, hey, I'm kind of changing gears and trying to be more of like an advocate type of thing.
Yeah.
Like, I'm getting more and more connections and finding more and more things and more resources and stuff like that. And it's so many resources that I didn't know about and I wish I did know about a long time ago, but I'm just glad that I'm being given the platform to show more people and to connect more people with resources um than they knew about in the past. So
Yeah.
I'm super excited about that. I'm super excited about your journey as a mental health professional, and going towards education and just being a pillar of light and encouragement to people, not only in our community but the the patients that you're serving. And I'm really excited to see where you go from here.
Thank you. I'm also excited for you. And I just know that if we can have more folks that are geared in a way of advocacy, there can be some real change, hopefully, even with
Absolutely.
everything, all the darkness that we have right now.
Yeah, and this is the time to step up, is when we are faced with adversity, is the time to be the loudest. It's not the time to like go run and hide. I know it's scary. I know it is, but it's if you have the spoons, please do what you can to be loud and proud.
Yes.
Not to sound like
No.
like a cliche, but like for real, like be loud and proud, and you'll kind of you'll rub off on other people, and
Mhm.
and I will totally say that if you don't have the mental like wellness right now to do that, absolutely, like, do not feel bad about that, because you are not alone in that either. And the reason why I'm being so loud about it is because I can handle it right now, but there are times that I need to take a step back and need to be like, I am scared, or I am tired, or I am just, it's too much right now. And everybody has the right to say, I can't deal with this right now. I can't put more on my plate. I can't do more. I can't join more committees. I can't go to more meetings. I can't do this. Like, you have to take care of yourself too, because you're never going to be able to take care of other people if you don't also take care of yourself. And I should be, looking at myself when I say that, but but I do the nurse thing where I like do what I say, not what I do, kind of
Oh, yep,
thing.
yep.
Yeah, 100%. Is there anything else that we didn't touch on that you would like to talk about?
Hmm. Not that I can think of necessarily.
Okay. Do you want to share your practice and like how to get involved with, following um your like professional journey,
Um,
or
so since I just currently got my license yesterday, because I haven't been able to start any of that up. I'm getting a psychology today up soon, I'm hoping, and then I'm hoping to find some type of agency that will let me do like evening sessions, because like I love my full-time job right now, but the way it works is that we take on clients because it's an
Mhm.
act team, so like we just
Okay.
yeah, so we don't take in just like anybody. We usually take folks who've been in and out of the hospital a lot and meet a specific criteria. Um,
Yeah.
so I would love to be able to do more of like individual like counseling some evenings throughout the week, but I haven't got it set up yet because I still have to get paneled for insurance. And luckily, work
Yeah.
is going to cover at least the basic insurances.
Probably have to have like malpractice stuff too,
Oh,
like that kind
yeah.
of thing.
I have to get that
Yeah.
set up and it'll be a couple of weeks, but I'm not
Yeah.
sure. Maybe by the time you're done editing, I might have something up.
I was gonna say, I mean, we can just stay in touch, and whenever we do have resources from you, like whatever you want to share, whatever you feel comfortable sharing, we will absolutely put it out there and let people know where they can find their advocates.
Awesome. Thank you so much.
All right. So, and that is what she said. Have any titillating topics for the future? Still have some burning questions from today's discussion? Feeling frisky and now you want some action? Slide into my inbox at smutdidyousay69@gmail.com to find out how you can get in on this. And follow Queerlina for a link to education and resources related to today's topic and updates about our next show. Good night, my little smut heads.
Thank you for listening to Smut Did You Say? You can find links and resources mentioned in this episode in the description below. For a downloadable PDF of Nikki's resource handout, along with additional emergent support options for queer individuals, visit queerlina.org/helplines. That's queerolina.org/HELPLINES. Take care of yourselves and each other, and we'll see you next time.